Hi, it's Kamala Harris. How are you?
I'm good. Natalie Moore, WBEZ. I first have to say one thing to you, HU.
You know, we're everywhere.
We are everywhere. Vice President Kamala Harris, thank you so much for the interview. The timing is serendipitous. Tonight, I am hosting a WBEZ virtual event about Black people and the COVID vaccine, focusing on hesitancy and access. So we're glad to be able to share some of our conversation. When we talk about vaccine hesitancy in the Black community, it goes far beyond the infamous Tuskegee experiment. What are you and the administration doing to overcome historical medical distrust that some Black people have?
Well, first of all, let me say that I appreciate that you're going to be covering this topic. More than 2 in 3 Black Americans personally know someone who has been hospitalized or who has died from COVID-19. So this, is a real issue. It is literally killing the community at highly disproportionate rates. The suffering, the grief is immeasurable, not to mention the economic impact and the educational impact it is disproportionately having on the Black community. And so we have to address it, we have to deal with it, and we have to look at a number of issues, both in their historical context and in terms of what is facing us clearly right now as present issues. In terms of the history, well, look, the Tuskegee experiments, we can go through history and know that that there is a righteous reason for folks to be skeptical when they are, and if they are, as they are, aware of the history on these issues. And we must always speak the truth about it. We should never forget it. But on this issue, in this year of our Lord, 2021, folks have got to take this vaccine when it is their turn. It is safe and it will save lives. There is an extraordinary scientist, Dr. Kizzy Corbett, who helped create the vaccine. She is a Black woman, in addition to being an extraordinary scientist. I have taken the vaccine, so many of us have, and literally, we each have it within our power that when it's our turn to get this vaccine, it will save our lives, the lives of our family, our friends, and our community. And we can't afford to not take advantage of this when it is our turn. We just can't.
Access is also an issue in communities of color, with many Chicagoans who are eligible but can't find appointments. Yesterday, President Biden said every adult can get a vaccine by the end of May, but what is the racial equity plan around access?
Right, and that's right. And I will tell you that I think that the access issue is increasingly becoming the issue, or more of the issue, than hesitancy. Because in my travels, mostly virtually these days, but in my travels, folks are saying, "I want the vaccine. How do I get it?" So one, we recognize that when we look at the disparities around who is actually getting the vaccine, yes, there is some hesitancy, but we also want to make sure that there's not an accessibility issue. We created a task force. We called it the COVID-19 Equities Task Force, headed by Dr. Marcela Nunez-Smith, to actually, in real time, track who's getting the vaccines and making sure that everyone who is entitled is actually having it in a way that is accessible to them and available to them. We have, for example, dedicated vaccines to community health centers, 2 million that we sent right to them. We did 1 million to pharmacies so they'd be in the local communities and in places where folks trust. I'm in DC right now. I just went out to the southeast part of DC, which is a predominantly Black community, to the grocery store there that has a pharmacy, and witnessed, folks from the community who that's their trusted place to go getting the vaccine. So we're targeting local communities, community health centers, and also tracking it around the racial disparities in terms of accessibility, to make sure that that is not an issue. Mobile vaccination units are another way that we are working on making sure that there is accessibility. And in Chicago, we are building a new site at the United Center in Chicago, which is going to open on Tuesday, March 9th. I will also tell you that on Thursday, March 4th, going backward, the appointments will start for people who are 65 and older. And then on Sunday, March 7th, if there are any appointments left, slots will be open to essential workers and first responders and adults with underlying health conditions. But I'd like to have your listeners go to ZocDoc.com. It's ZocDoc.com/vaccine, so folks can sign up for appointments to get the vaccine.
Speaking of inequities, the pandemic and vaccine rollout have only underscored racial and economic inequities in this country. What will your administration do to change this? And will you use your authority as vice president to include a $15 an hour minimum wage in your COVID relief bill?
So in terms of inequities, listen, first of all, we have to recognize that when we talk about equality, which is something we've all been fighting for forever, and those who fought before us were fighting for it. But this is a fight that is about making sure people end up in the same place, right? So when we talk about equality, we have to appreciate that there are folks who start out on first base and there are folks that start out on third base. And so if we're talking about giving everybody an equal share, folks will not be able to catch up. Equity is about making sure that people end up in the same place. So when we look at it in terms of how we're targeting the vaccines, when we address, for example, what we are doing around minority-owned small businesses and making sure that in the first 2 weeks of the distribution of support for the PPP, that small businesses that have 20 or fewer employees are first in line. We know that the majority of Black-owned businesses are in that category. These are the kinds of things we are doing to deal with racial equities. Minimum wage, I mean, you know, you're right to talk about that. I have been fighting for $15 an hour minimum wage since the beginning of time, it feels like. Most people may not understand that $7.25 is the current federal minimum wage. You know what that means? If you work 40 hours a week at federal minimum wage as it currently stands, you are earning $15,000 a year, $15,000 a year, which means that folks who are working a full day's work, a full week's work, are existing below the poverty line. We have to increase minimum wage. And we are going to fight for that. We're not going to give up the fight, even though the parliamentarian said that it can't stay in our bill. But it is one of my biggest priorities. The last numbers I saw, the dominant population who are minimum wage workers are women and women of color. And so there is a direct connection between minimum wage, what it stands as, and how folks of color, in particular Black folks, are doing economically.
I just want to follow up. Given that parliamentarian rule, will you use your authority as vice president to include it in the relief bill anyway?
Well, listen, we were very disappointed in the parliamentarian rule, but we are committed to working with Congress to determine the best path forward. And the bottom line is nobody in our country should work a full day's work and work 40 hours a week and live in poverty.